In this video presentation we will discuss about bovine tuberculosis. Bovine tuberculosis. Bovine tuberculosis (BTB) is a chronic bacterial disease of animals characterized progressive emaciation, formation tubercles in lung and enlargement of lymph nodes. Etiology of bovine tuberculosis. Bovine tuberculosis is caused by members of the Mycobacterium tuberculosis complex, primarily by Mycobacterium bovis, but also by Mycobacterium caprae and to a lesser extent Mycobacterium tuberculosis. Epidemiology of bovine tuberculosis. Host of bovine tuberculosis. Cattle are mostly affected by Mycobacterium bovis. But other domesticate and wild lives have been affected by Mycobacterium, including African buffalo, domestic Asian buffalo, bison, sheep, goats, equines, camels, pigs, wild boars, deer, antelopes, dogs, cats, foxes, lions, badgers, tigers, and leopards. Geographical distribution. Bovine tuberculosis is found throughout the world, but some countries have never detected TB, and many developed countries have reduced or eliminated bovine TB from their cattle population and kept the disease limited to one or more zones. However, significant pockets of infection remain in wildlife. The highest prevalence of bovine tuberculosis is in Africa and parts of Asia, but the disease is also found in countries in Europe and the Americas. Transmission and spread. The disease is contagious and can be transmitted directly by contact with infected domestic and wild animals or indirectly by ingestion of contaminated material. The usual route of infection within cattle herds is by inhalation of infected aerosol, which are expelled from the lungs by coughing. Calves can be infected by ingesting colostrum or milk from infected cows. Humans can become infected by ingesting raw milk from infected cows, or through contact with infected tissues at abattoirs or butcheries. The course of disease is slow and takes months or years to reach the fatal stage. Consequently, an infected animal can shed the bacteria within the herd before the appearance of clinical signs. Therefore, movement of undetected infected domestic animals is a major way of spreading the disease. Clinical signs. Bovine tuberculosis may be subacute or chronic, with a variable rate of progression. A small number of animals may become severely affected within a few months of infection, while others may take several years to develop clinical signs. The bacteria can also lie dormant in the host without causing disease for long periods. The usual clinical signs include weakness, loss of appetite and weight, fluctuating fever, dyspnea and intermittent hacking cough, signs of low-grade pneumonia, diarrhea and enlarged lymph nodes. Post-mortem findings. Cheesy abscesses in the lungs, cream to orange color. Tuberculous granulomas, tubercles, in lymph nodes, particularly in bronchial, retropharyngeal, and mediastinal nodes. Discrete and nodular lesions containing thick, yellow to orange, caseous material, often calcified and surrounded by a thick, fibrous capsule. Diagnosis. Bovine TB clinical signs are not specifically distinctive and, therefore, do not enable veterinarians to make a definitive diagnosis based on clinical signs alone. The tuberculin skin test is the standard method of TB diagnosis in live domestic animals. It consists of injecting bovine tuberculin, a purified protein extract derived from Mycobacterium bovis, intradermally and then measuring skin thickness at the site of injection 72 hours later to detect any subsequent swelling at the injection site, sign of delayed hypersensitivity associated with infection. Blood-based in vitro tests that detect bacteria, antibodies, or cell-mediated immunity are also currently available, or under development. The most widely used blood-based test is a gamma interferon release assay, which detects a cell-mediated immune response to infection with Mycobacterium bovis. This test is based on the principle that bovine blood cells that have previously been exposed to Mycobacterium bovis through an infection are known to produce elevated levels of gamma interferon following in vitro incubation with Mycobacterium bovis antigens. Meanwhile, the definitive diagnosis is confirmed by bacterial culture and identification in the laboratory, a process that can take 8 weeks or more. Prevention and control. National control and eradication programs based on test and slaughter of infected animals have been successfully implemented in many countries, as the preferred approach to managing bovine tuberculosis. However, this approach remains impractical in some heavily infected countries because it could necessitate slaughtering large numbers of cattle, and this may not be feasible, due to human resource or financial limitations within the animal health program, or for cultural reasons. Therefore, countries use varying forms of test and segregation in early stages, and then switch to test and slaughter methods in the final stage. Several disease eradication programs have been very successful in reducing or eliminating the disease in cattle, by employing a multifaceted approach that includes post-mortem meat inspection looking for tubercles in the lungs, lymph nodes, intestines, liver, spleen, pleura, and peritoneum for detection of infected animals and herds. Intensive surveillance including on-farm visits. Systematic individual testing of cattle. Removal of infected and in-contact animals. Adequate local legislation. Effective movement controls. Individual animal identification. Effective traceability. In addition, sanitation and disinfection may reduce the spread of the agent within the herd. However, Mycobacterium bovis is relatively resistant to disinfectants and requires long contact times for inactivation. By this we are coming to the end of this lesson.